Assalamualaikum. Welcome to today's session, Day 3 of Dao University Virtual Open House. I am Linda Razak Neyman and I am Program Coordinator of Dental Technology Program from School of Dental Professionals, and I am here the moderator for today's session. Before we proceed further, let us start with the recitation of the Quran. Before we move forward, let me give you the brief of what you guys are going to expect from today's session. Today we have three institutes of Dao University of Health Sciences on board: Dao Institute of Medical Technology, School of Dental Care Professionals, and Dao Institute of Radiology, with a team of their expert panelists, and they are going to give you the virtual tour of the academic prospects of the programs available in their institutes. First, we are going to move towards the Dao Institute of Medical Technology, and let me welcome the respected panelist, Dr. Nida Beg. She is the part of Dao Institute of Medical Technology since 2007. She is the assistant professor and program coordinator at Dao Institute of Medical Technology. She is a medical doctor with MPhil in chemical biochemistry and molecular biology, and currently pursuing her PhD in biochemistry. Over to you, Dr. Nida.
Thank you very much, Linda. And good day to everyone. As she has already introduced me, I am program coordinator for Clinical Laboratory Sciences, and I'll take you through this virtual tour of Dao Institute of Medical Technology. Correct. Dao Institute of Medical Technology actually is 1 year shy of when Dao University of Health Sciences came into being. That it started off in 2006. And the first program started as Institute of Medical Technology, and it was one of its kind in entire Pakistan, because Dao University of Health Sciences is a much player in offering an undergraduate program, 4-year undergraduate program in the disciplines of respiratory and critical care technology, ophthalmic technology, whereas clinical laboratory sciences and surgical technology was being offered before the Dao Institute started it. So not only this, later on in 2011, Dao University again was the pioneer to bring in a program, a 4-year program again, an undergraduate in Perfusion Sciences as well. So so as I said it, that it's offering a program, undergraduate program in 5 different disciplines: clinical laboratory sciences, and the program coordinator for clinical laboratory sciences, clinical ophthalmic technology, respiratory and critical care technology, surgical technology, and perfusion sciences. And the faculty, which will be anyone who is actually pursuing to get entry into these programs, will be actually having a very wonderful journey, because we do have a very nice faculty team of faculty members. Clinical laboratory sciences, each program has got a program coordinator, which is inclusive, which is inclusive of the program coordinators along with the lecturers and assistant professors. You can see it, clinical laboratory sciences has a program coordinator. Along with that, it has got 5 lecturers in it. Respiratory and critical care, besides the program coordinator, has an assistant professor, senior lecturer, and 1 lecturer and 3 lecturers. Surgical technology similarly has got an assistant professor, lecturer, and clinical ophthalmic technology has got 1 senior lecturer and a program coordinator, which is of course involved in teaching as well. Perfusion Sciences has got 1 program coordinator who is assistant professor and 1 lecturer, whereas Basic Sciences, we have got 5 lecturers from Basic Sciences subject, which we offer in the first 2 semesters. Now, moving on to the academic calendar, the program is about 4 years, and each year has got 2 semesters in it. We do have an odd semester, or even we named it on odd, but of course the classes commences from February and last till July, and you do have 1 month of a summer break as well. Each semester lasts for about 21 weeks, inclusive of 1 week for examination preparation and 4 weeks of the clinical practicum placement, and of course 10 days for terminal examination. And the second semester starts in September and ends in January, and subsequently the cycle repeats itself. We are actually equipped with skill labs as well, and a computer lab. Skill labs, a clinical laboratory sciences department, ophthalmic and surgical technology department, and of course RCC also have fully equipped skill labs, in which students during the academic session, when they are having a didactic classroom teachings, can have hands-on practical work done in these skill labs. And besides that, we will move on to how a person, a student or a putative candidate wants to get entry into the program needs to have a high school graduate or an inter with the 60% in your inter level, and you need to sit for a prerequisite entry test, and the cumulative result should be 60% to enter into the merit list, and you should be having a bearer of synth domicile. We do not cater anything about the self-financing right now. And the fee structure for the IMT is that the admission fees, which you have to pay initially at the time of admission, is 29,000. In this is inclusive of Dao Endowment Fund, which is you have to pay once at the time of admission, that is 10,000 rupees. And then you do have a tuition fee for 2 semesters combined, that is 1 year, it's 93,170 rupees. And RFID card is about 1,000. And then if you cumulatively look at the fees without transport is 1,34,710 rupees. Whereas if you include, and if anybody wants to avail the transport services, has to pay extra 15,000 rupees. Moving on to the introduction of individual technology programs, which we are offering, clinical laboratory sciences. It's a very exciting field. Anyone who loves hands-on action and is looking for puzzles or love being a part of the crime scene, see, clinical laboratory sciences is the answer or is the profession for you. Nonetheless, these can be said, 70 to 80% of all of the medical decisions which are made either in inpatient departments, outpatient or doctor offices, they are based precisely on the results which are generated by these professionals, which are working along with the consultant pathologists in the diagnostic laboratories. One can actually pursue a career in a number of places. Once you graduate, you can end up in the diagnostic and research laboratory, whether it's in a large hospital setup, it's in private laboratories, physician, armed peace crops, public health medical research, or you can work in industry, whether it's a pharmaceutical industry or non-pharmaceutical like diagnostic manufacturing industries. You can work in blood bank as well. You can end up in the quality control department, or if you like to pursue and you have a flair to be involved in management, you can actually be in the managerial position as well. And if you like to pursue and end up in academia, you can also actually pursue your degrees, higher degrees, even to the PhD level in microbiology, clinical chemistry, molecular biology, so on and so forth. Respiratory and critical care technology is another program which is offered by Dao University. This program is very much to deal with the patient. The graduates who are in this program will be trained actually to ensure that people with pathologies of the lung and the cardiac, where they have a breathing problem, they breathe smoothly and their life becomes much easier. So they're trained in that way. They actually work with the physicians, again, with the pulmonologist, where they are working in the intensive care unit. They are trained in this way to help patients breathe. They work with ventilators, with various devices which help to diagnose what respiratory problems the patient has. And they help in management of acute and or chronic dysfunctions of the cardiopulmonary system. They end up in intensive care unit, whether it's medical, surgical, neonatal, or emergency departments, and they work along with anesthetics. They work in community care settings. And when we say that they help patients to breathe, they end up in sleep labs, in rehabilitation, respiratory rehabilitation centers, palliative care centers, and hospitals as well. Surgical technology. This also is much to do with the involvement with the patient, but here the involvement is not mostly in the ICU. So they are mostly end up in the theaters, in the operation department, in the surgical technology. They are trained to assist the surgeon. The students who graduate will be actually sterilizing with these surgeon and helping in the surgery as well. They are well equipped with the knowledge of how to handle all surgical instruments, how to sterilize them. They are very much trained to control the infection. They are involved in infection control as well. They actually end up in the gastrointestinal, pediatric, gynecology, orthopedic, neurosurgery, cardiac, traumatic surgeries. They do have a variety of spaces they can work in. They work as an OT manager. They can work as an assistant OT manager. They can work in a trauma center. And of course, with the advent of the robotics in the surgery now, they can actually, their job is going to be redefined as a robotic technologist as well, and actually assisting those surgeries as well. They can end up in CSSD, which is the Central Sterile Supply Department as well. Clinical ophthalmic technology, as it says it is much to do with the care of the eye. When we say with the care of the eye, from the examination to the identification of defects, whether they are the physical defects or the defects of the structure inside the eye, or any ocular disease identification, whether it's infectious or not. And they are involved in dispensing and identifying the optics. That means they can do optometry practice as well when they're trained that way. And they actually can work in the community in opening up their own business in an optometrist and having a shop where they can dispense off the lenses and the spectacles. And they are actually, again, working with the ophthalmologist, whether it's a surgical ophthalmologist or the clinician who's dealing with the eye surgeries or eye diseases treatment. The workplace, as I said, it can be in hospital, clinics, outpatient centers, surgical centers, and they can work in the community as well. Moving on to Perfusion Sciences. This was the last one, which Dao Institute introduced in 2011. It is a very critical and very sensitive technology. Here, people end up again in the theaters. They work along with anesthesiast, with the surgeon. They cardiopulmonary. They are actually operating the cardiac and heart, pulmonary and heart bypass machine. When we take the patients into CABG, that is heart surgeries, we put their lung and heart into rest, and it's the machine which is dealing with it. This is their major function, and they end up in, of course, in pediatric surgeries, in adult surgeries. They work as extracorporeal membrane oxygenation surgeries. They work in limb salvage surgeries. They're involved in liver transplant, lung transplant, and heart transplant as well. So they end up finding a lot of space in the hospital, jobs in the hospital only, and they do have a very intensive workload because they can be called for emergency surgeries as well. Thank you very much.
Thank you so much, Dr. Nida. And if you guys have any questions related to this program, you can drop your questions in the comment box, and we are going to answer those questions in real time. So, Dr. Nida, we have received some questions from the prospects. They are basically asking if you guys offer any kind of scholarship to the students.
Yes, we do offer scholarships. We have scholarships coming from directly from Higher Education Commission as well, which sorry. SAS scholarship, the ones which are coming from HSC, from Higher Education Commission. And I over this question to Mr. Zishan Jafri, who's the moderator. We'll give you a better answer on that.
Okay. Yes, Mr. Zishan, can you please brief about the scholarships, that what is the criteria of the scholarship?
Need-based and merit-based.
Need-based and merit-based. So do students have to maintain their CGPA to you have that scholarship for throughout the session, or the scholarships are just for the semester? Okay. Okay. We have another question is regarding the examination paper pattern of the entry test.
The entry test, it is basically what you have. People who will be opting for this will have to be coming from the pre-medical background, or they have done their high school in mathematics, physics, biology, I believe chemistry as well. So you need to be prepared with your entry level, with your inter-level knowledge, along with English, mathematics as well is included in the pre-entry test. Okay, and you can find a lot of information. The pre-entry test is quite centralized. So if you go on the NTS department, or this one more department, which is we do have website links which we can share with this with the potential candidates who want to apply. They can actually seek a lot of information from there as well. But the pattern remains the same, that you need to have a basic knowledge in mathematics, English, and of course what you have learned at your high school level.
Okay, what about the admission criteria of your program? Can you please briefly describe
again? Okay, the people, of course, as I said it, need to have at their high school. That means when they have passed their inter, at least 60% they should have secured. Now, after the initial long listing, then those students are called to sit for those prerequisite examination, which is of course decided by the admission department of Dao University of Health Sciences. Once they sit for it, they are actually their result, and their result from the inter level is cumulatively taken, and again they have to actually secure 60% in either of them. The weightage for the inter is actually given about 20 to 30%, whereas the 50% marks, the weightage is coming from your entry test. And they cumulatively, and I think the remaining 20% is coming from the what you secured at your metric level. And then they cumulatively make this equation. You need to have a 60%. Once you actually achieve those 60% marks, you are shortlisted, and Dao University sends you the invitation to come for the interview. And then we do have an interview. So it's a merit based. So first come, whatever the merit list is prepared. We have 20 seats in each discipline, total laboratory sciences, all the 5 disciplines. So whichever seats fill first, of course, according to the merit list.
Thank you so much. Dr. Nita, can you please brief us about the tentative dates of your classes? When can the student expect the classes to begin?
As I mentioned in the academic calendar, the session which is going to start, the admissions are usually announced in the month of October and November, and we're expecting the admissions will be announced soon. We start our session in February.
Okay. And what about the courses that you guys are going to cover in this 4-year program? Can you
the four-year program currently we have got 5 technologies with catering. We have got 2 semesters in each year. That means we end up with 8 semesters. The first 2 semesters are very much dedicated to teach all the basic sciences subject. That is, we are going to teach them anatomy, physiology, biochemistry, pharmacology, medical terminology, how they will get, because they're coming from a background where they have no exposure. Definitely nobody has it when you enter into MBBS. So we're going to teach you medical terminology, and then move on in the second semester. We're doing the same thing. In the second semester, we introduce the subject respective to the technology. Right? We will be introducing the subject of medical laboratory sciences, and those students, out of 100 students, those 20 are going to just take that subject. And each technology is going to offer their respective subject, and that's going to be one subject, is one course is offered. Now, from the third semester onward, the students completely divide, and they're more concerned with their department where they opted to enter. And then they are going to be taught their respective subjects. And if you want me to go into the detail of explaining that, that has got a lot of subjects to talk about for individual
I think
technology.
The prospects got the idea what they can
Yes,
expect.
exactly. But they will be expecting in the first 2 semester basic sciences. All the light basic sciences in terms of what anatomy, physiology, as I said it, biochemistry, pharmacology, microbiology, and infection control, psychology, sociology, laboratory, computer labs and skills, English, Islamia, Pakistan studies.
Okay, Dr. Vida, the questions we are receiving are more focused towards the admission process. So students are curious that do you guys take the interviews when finalizing the
Yes, we do.
students for the
We have corporate interviews.
So what is the so how they are selected? What's the admission process of this
Interview?
Yes, how exactly? What are the criteria?
Okay, I see. Depending, of course, when you will go for the interview, the interviewee will be definitely asking you why, what you're opting, what is your first choice, and if the first choice is available, of course, they're going to offer you that. But if it's not available, they're going to tell you that the seats are available in this. Besides that, they're going to ask you that why are you interested? Why X technology was your first choice? For example, respiratory and critical care technology was your first choice. You need to actually, first, depending on your answer, but that answer is not going to affect your placement. If there's a seat available for respiratory and critical care technology, you will be offered.
Okay. If we talk about the graduated students of your program, of your institute, can you please let us know what exactly your graduates are doing right now and what exactly, where are they involved, the alumni of your institute?
Yes, I can actually, I should have included that slide where actually we showed it graphically that so far how many students have graduated and how many are actually currently where they're. So we made that, I took that slide out, but of course I can tell you now, of course our students in the alumni are thriving very successfully. More than 40% of the graduates, which so far up till now in present 2020, more than 40 to 50% has been consumed by our University of Health Sciences itself. So you can imagine Dao University of Health Sciences is such a huge university itself that it consumes more than 40%, which is a very positive and a plus sign. Besides that, we do have graduates who have ended up as managers, pursuing their field, as managers pursuing their field in their respective field where they graduated. We do have a number of alumni who are working abroad, like in Saudi Arabia, in Kuwait, in South Africa, in Dubai, in United States of America. And one important good thing which I need to add over since you're asking it, one good information information is that students who graduate from clinical laboratory sciences, they can actually sit for their Board of Certification examination of American Society of Clinical Pathology. And the good news is that to sit for that exams, if you are based in Karachi, you can take that exams in Lahore because Lahore has been recognized as an ASCP examination center. And it does offer Board of Certification examination down there. And they have given the entire admission criteria. One important good news is that all you need to do is that you have to submit your credentials to the international credential verifying bodies. When you do that, they actually accept your credentials. And three of my students have recently, one from Canada and one from America has done that. They got their credentials verified and they're sitting for the Board of Certification exams. They are the two students who are actually precisely there, they're doing it. But there are a number of other students who have actually set the exams here and have verified. And they have actually got the certification. Besides that, in United Kingdom, we do have IBMS, that is Institute of Basic Medical Sciences. They also offer credentials. And similarly, you can sit for the certification exams once your credentials are verified. One important thing, if you sit for ASCP certification exams, you don't need to get a certification from from any countries, from the Arab countries like UAE, Saudi Arabia, Kuwait. You don't need to sit for the exams for the Dubai licensure, the UAE licensing exams. You can actually opt for the job and the job prospectus increases. And those certifications last for 1 year. You have to renew it or verify it, and you have to maintain your continuous medical education profile as well. And besides that, surgical technology is actually on the road to do that as well.
Okay, I guess they already understand what great future prospects this program has. Okay, Dr. The students are concerned that since Dao has many campuses, so in which campus the program is offered?
The program is being offered in OJA campus.
Okay, and what do you think that what kind of opportunities are there for the students to broaden and deepen their knowledge apart from the lectures?
Of course, said it when I was actually showing you the academic calendar, that you do have a 4 weeks of placement in the clinical placements. Actually, this clinical placement is for 4 weeks at the end of the semester. Now, this 4 weeks placement actually helps you to get acquainted not only what's happening in Dao University of Health Sciences, rather what's happening all around in Karachi, because our students do not do their clinical clerkships or their clinical practicum in Dao University. We have got a very good portfolio and relationships with all the laboratories, hospitals, different eye ophthalmology outsourced departments throughout the Karachi. Our students end up doing their clinical practicums besides AKU. Of course, we end up doing it in NICVD, NIVD, in private, in ESA laboratories, in LRBT when it comes to eye, and MMI. So our students will have a lot of opportunity to actually build their portfolio by working with those different people, because they have a variety of exposure. Not within, working within the campus is really different, but when you're exposed to people who are not actually from Dao University, you get a variety of taste, and that's where they develop their personal and professional skills, and of course those skills as well.
So when you say that you have different institutes and different hospitals where your students are going and doing their practice, their clinical practice and whatever studies they are doing. So other than that, do your institute offer any internship?
Yes, we do. Yes, and of course we do. Dao University of Health Sciences is very generous in embracing their students and facilitating their students. When you graduate from here, you do offer an internship, and that is a paid internship, and it is for 6 months. And but we do place them within Dao University of Health Sciences. We actually do send you to civil hospital as well, and that's where they are rotated in different departments, depending on, again, this is merit-based. What we do when we offer the internship, we prepare the CGPA results which are coming from the last 2 semesters. We call in the students and we offer them, and it's a merit-based, so whatever the seats for us. Yes.
Okay, Dr. Da, we have a question.
And we have a complete policy for internship as well.
Okay, so we have a question related to your admissions to your program, is that can students apply for all these programs together, or they have to select one specialization of medical technology?
Okay, all right. This is the answer is very simple. When you apply to Institute of Medical Technology. You do not have to specify in the admission form, is there any choice given? Yes, they do ask you, but you have to just mention first 3 choices, which of course definitely we will look into when we will call you for the interview. Once you meet the 60% criteria on the prerequisite test and on your enter level.
Okay, so basically the institute is offering different programs, and the student is going to be shortlisted for these programs.
No, not exactly for these programs. Once they enter, they apply for the admission, they meet all the entry prerequisite criteria, they sit for the exams and all that, they're shortlisted, the interview call goes. We at that time are not judging in which technology they want to end up. Because students do like their choices, but when they're in the interview, they come up with totally different choices. So we keep that thing open. We give them that much space, right, to decide at that point in time as well, because they will be getting a lot of feedback as well. Now, I believe this session is going to help them to choose the subject as well, the discipline, what they want to opt for.
Yes, we have a very detailed presentation here related to the program, so students can even see the recordings and even see in the real time that what are the prospects they have for the future and what kind of programs are offered in this institute. Okay, talking about the facilities. So, do your campus provide any hostel or transport facility to the students?
Transport facilities, of course, is there. We actually mentioned it without transport and with transport. There's 15,000 rupees students have to pay if they want to avail the facility of transport, which is offered in Dao University. Besides the hostel, we do have in hospital.
Since the institute is available in Sindh only, and usually the students are from Sindh and have the Sindh domicile, so the hostel facilities is usually not availed by the students. So we don't have it available at the moment. Okay. If we talk about the academics, yes, you have given us the brief of the how you guys are dealing with the academic programs. But other than academics, students are also interested in the curricular activities and what is the exposure of these activities at your institute. Means what kind of
they do participate in all the extracurricular activities which are offered or which are being conducted within Dao University. Besides that, they do get involved in a number of community activities as well. All right, and recently, not recently, it's been this program which was conducted. I mean, these kind of activities, of course, keeps on going on. We do offer, besides extracurricular activities, sports program. If there are any kind of drama programs which is being offered in Dao University, our students do participate in that. Any Naat competition, any singing competition, Pakistan Day celebration, Eid Milad al-Nabi celebration, of course, our students participate in all those kind of activities.
So, is your academic load is divided that way that your students get the chance to participate in these activities?
Yes, we follow the HSC's strict criteria of not offering more than 12 to 15 credit hours per semester. Okay. So that gives them ample of time to actually have a little fun as well.
Okay, if we talk about the assessment methods, when the student is already enrolled in your program and they are going through the semester, so what exactly are the assessment methods on what basis you are going to evaluate your student?
The assessment method is that it's of course it's going to be an ongoing process. We evaluate them not only by actually giving them a simple quizzes and question and answers or a subjective paper. We actually ask them to actually improve their presentation and their presentation skills, and of course how they are going to relate with their peers and how they're going to relate with their faculty. We actually offer them presentation skills. We ask them to develop their own teaching assessment methods in a way that we ask them to do a group discussion and give them those assignments, and then actually ask them to work as a group, so we can actually see the leadership skills as well in them and how they coordinate when they are in group as well. Now, the very strict criteria of the assessment, of course, we do have a midterm examinations, we do have internal evaluations, and we do have a terminal examination, which is conducted. The terminal examination is conducted by the main campus, main department, main examination department, whereas the internal evaluation and midterm is within the institute, and that depends on the faculty involved, that how the weightage they are going to give for each test or quiz or an assignment they offer to the student. We do have one important thing. We do have students have to take their research methodology subject as well, and from the third year, sixth semester onwards, they have to be actively involved in performing their whatever the research project they have developed. So that also gives them a lot of edge in doing the presentations of the findings they have found, whatever they have done in the research project. So these are the ongoing assessment methods for the employees.
So we can say that the Institute of Medical Technology just doesn't train students in academics, they train students with other skills as well. Either it's their leadership skills, either it's their team building skills, etc. So when we talk about the assessment, some prospect students are concerned that if there will be mathematics or computer-based subjects in your course outline, as some students find these subjects rather difficult and tricky.
Yeah, but believe me, you don't need to worry too much before time. Way before you enter into a program, when you enter a program, we're going to make sure that your journey with Dao University of Health Sciences lasts a lifetime with you, and will embark you on a journey of self-discovery as well. So the mathematics and computer skills is not going to be that difficult. We have very trained and very skilled teachers. We do have the entire computer IT department, and we have very apt teachers down there to cater to your needs. And of course, the mathematics is going to become easy for you.
Okay. And what kind of academic support your program provides to students? What kind of
In terms of academic support, what do you want to ask that? Do we provide?
If the students wants to broaden their knowledge, for example, in libraries or
We do have that because we do provide them with the reading library. We do have a reading library as well. And besides that, Dao University has got a main central library, which is very equipped with books on all the subjects related to biological sciences, life sciences, medical sciences. So here it's a storehouse of knowledge. It depends on how thirsty the student is to actually explore it. Besides that, we do also provide online resources to explore, and this is the basic academic. And we do actually, when we are doing the internal assessment, we do actually provide those kind of assessment tools, which actually help them to use their analytical skills as well, and which are more thought-provoking. So the academic support is cannot be actually defined just in terms of providing libraries and books. It's quite a dynamic and ongoing process. So it's always there.
So teachers are there as well.
Yes, of course, definitely is always there. So we do have a very open house policy. They can walk into any faculty's room and any faculty member's room, and they can actually raise their queries, their concerns, whether it's academic or whether it's non-academic as well. We do have a in-house IMT has got their own student affairs session as well. We do that as well.
Okay, thank you so much, Dr. Nida. Dr. Nida was here with us to answer your queries, but if still you guys have any queries, you can drop your questions in the comment box and they will be answered in the real time. So moving towards the next session and the next institute, we have School of Dental Care Professionals. We have School of Dental Care Professionals on board with a team of their expert panelists. We have our esteemed principal, Professor Amrita Qureshi. She is a PhD in community dentistry and chairperson of community dentistry department. We have Honorable Vice Principal, Dr. Mohammad Khwaja Hamaduddin. He has done his postdoctorate and doctorate in biomaterial sciences from UK and is assistant professor at the Department of Science of Dental Materials. Along with them, Ms. Madiha Shabir, the program coordinator of dental hygiene, is joining. She is a graduate of dental hygiene and has done her master's in public health. Over to you, Ms. Madiha.
Assalamu alaikum. As Ms. Nimra told earlier, that I am program coordinator at the School of Dental Care Professionals. My name is Madiha Shabir. So I'm glad that we are having this session so to have your queries addressed. Talking about School of Dental Care Professionals, the School of Dental Care Professionals came into existence with the concept of four-handed dentistry. By four-handed dentistry, I mean the two hands of the dentist and two hands of the dental auxiliaries. So the entire team having knowledge pertaining to dentistry work together in a single setup or a hospital setting. Well, the school was established in the year 2007 and under the administrative control of Dao University of Health Sciences. And it is a pioneer in initiating a 4-year BS program in dental auxiliary sciences. Well, the goal of the school is to produce leaders in operational performance who continue to create awareness and elevate the health status of the community. However, the course is intended for those individuals who are interested in skill-based learning. Well, talking about our faculty, we have highly qualified and we have highly qualified and experienced faculty with international qualification. Our esteemed principal, Professor Dr. Amrita Qureshi, she is a PhD in community health. Next is our vice principal, Professor Dr. Khwaja Hamaduddin. He is a postdoc from an international university. Next, we have program coordinators. We have Ms. Nimra Razak Maimun, program coordinator for dental technology, and I am myself program coordinator for dental hygiene. We have separate faculty for both the subspecialties, On left, we can see the faculty for dental technology. On right, we have faculty for dental hygiene. And they are all trained in their respective fields, and they are all being supervised by dental practitioners who have a PhD and who are fellows, who are diplomats. They all are being supervised by those faculty members. While we recently have started Green Youth Movement Club as per our Prime Minister's program. And Ms. Afsha Jahangir is coordinator for the club, and most of our students and faculty members are members to this club. Well, as I said previously, the school is pioneer in offering 4-year BS program in the 2 main fields, that is dental hygiene and dental technology. When you'll be coming here or you'll be opting the course, you will have to select one specialty, either dental hygiene or dental technology. Now, what is the difference between these 2 technologies? Well, dental hygiene, the course in dental hygiene will prepare students to provide primary oral healthcare services and preventive dental services. The skills that you will acquire during the coursework include health promotion, health education, primary oral healthcare, oral disease prevention, and building community health. While dental technology is a different field, the course in dental hygiene will prepare students to construct a prosthetic, restorative, and dental appliances. And the skills the students will acquire during the 4-year program include health education, constructing oral prostheses, oral rehabilitation. They will be involved in research work. They will be promoting health. Well, about our academic program, this is a 4-year BS program that is semester-based. So in total, we have 8 semesters, 2 semesters per year, and each semester is comprised of 16 weeks of didactic lectures and clinical or lab rotations where students are exposed to the clinical environment and they learn on clinical grounds. However, the first year is comprised of 4 courses, and to cover these courses, the students study these courses in Dao Institute of Medical Technology with other technology students, and from 2nd year onwards, students study in School of Dental Care Professionals. Well, the course is of 130 credit hours as per Higher Education Commission requirement, and after the completion of coursework, a student has to complete a 1-year paid internship, and that is mandatory for each student. The course is recognized by Higher Education Commission, and the degree from Dao University of Health Sciences is internationally recognized. Well, we have the campus is located, the School of Dental Care Professionals is located in Koja campus, and the facility is beautiful with a lot of greenery and cleanliness. Once you enter the campus, you will see that the serene environment is comparable to any international university. We have enough number of tutorial rooms with all the facilities and essentials to conduct our lectures, our tutorials. We have digital library that has the student will have access to this library once they are registered in the course. You have services of gym, you have services of point, shuttle services, and we have common rooms. Then for clinics and labs, our students are located among different departments, and we share the clinics and departments of Dr. Ishrat Institute of Oral Health Sciences. So this gives students a bigger picture to work on a large scale on clinical grounds with patients and with other professionals who are also practicing there. So this gives them a bigger exposure to, a larger exposure to clinical. Well, we have a dental laboratory, ceramic lab, cross-flow lab, dental materials lab, where students are engaged in the learning process. As I already told, this is a skill-based learning, and in order to learn skill, one has to be in the laboratories, in the clinic, and we have this option for students that when they are on off or on vacations, they may join these laboratories and clinics for electives. Well, about career path, our students, the program, the 4-year BS program, offers a quite a wide range of career paths. And once you are graduated from the institute, you can be a clinically oriented dental hygienist or dental technologist. You can work in private clinics. You can work in dental hospitals. You can work in government setups. And then you may join academia and progress through healthcare research. You may pursue with marketing, or you can join pharmaceutical companies once you have graduated. You can open your own clinic, dental clinic, and dental labs with the primary focus on oral healthcare, primary oral healthcare, and preventive dental services. So the course offers, since the degree is the university is internationally recognized and the degree is recognized by Higher Education Commission, there is ample room for you to progress and to continue with your studies. You can go on with masters in public health. You can go on with masters in public administration. You can go on with business administration. You can pursue your career in dental biomaterials. You can pursue you can be an expanded dental practitioner. Other than this, you can also opt to be a dental educationist. You can be a dental health advocate, or you can be appointed in schools and colleges as a dental health educator. Apart from this, the degree in dental hygiene and dental technology, these degrees are in growing demand internationally. And for those who are planning to work abroad or work in the institutes abroad, this is the right choice for you. Well, about the admission criteria, those who have passed intermediate with pre-medical or have given the equivalent exam and acquired at least 60% of marks may apply for this course. So this is a single course that is offered in SIM. So you must have a domicile of SIM. While students who have studied A-level, they have to submit an equivalency certificate in order to be registered in the course. Well, about important dates, the advertisement takes place in November and December, and admissions are taken in January. However, our first semester, the spring semester, starts in February, and midterms are conducted around in April, and then followed by semester examination in June. We have a semester break in July, and during the semester break, students may opt for electives or for clinical practice or after necessary permissions. Then our fall semester starts in August and it ends in December. This is the whole year program. Actually, it is semester based. We have 2 semesters in a year, a spring semester and a fall semester. About fees, this is the fee structure of the program. The admission fee has to be paid at the beginning, and once it is paid, it is non-refundable. And this entire structure is annual based. This fee structure is annual based. That means you will have to pay this fees once a year. Examination fee has to be paid around when the examination is about to begin. And we have transport facility as well. An addition of 15,000 to this amount will be seen after you avail the facility of transport. So in total with transport, the fees per year is 1,35,361 rupees. However, these amounts may be taken as tentative, and there is an increase in amount, or this amount is subject to revision. And I advise you all to visit the website for necessary updates. Thank you so much. If you have any queries, you may ask. We are here to address your queries.
Thank you so much, Ms. Madiha. And if you guys have any questions related to this program, you can always drop your questions in the comment box, and the team of expert panelists is here to answer your queries. So we have started taking your questions already. And students, the prospect students are basically concerned about the admission test pattern. So what do you suggest that what exactly would be the admission test pattern of your program? How students have to prepare themselves for the test?
Well, the admission test is actually centralized, and most of the admission test is comprised of questions related to English, maths, chemistry, whatever you have studied in your intermediate, that questions will be asked. So you need to be prepared in your intermediate course, and generally in English subject, those questions will be asked in your entry test examination.
So basically, students have to prepare generally for the science subjects or
Science
the
subjects,
English,
yes.
biology, based on the intermediate syllabus. Moving towards another question we have is regarding the scholarships your program offer.
Bismillahirrahmanirrahim. Assalamu alaikum. I would like to welcome you all on the great forum of virtual forum. We have, yes, we do offer scholarships, and we have got two programs, which is HEC need-based scholarship and also the SAS program. Currently, we have enrolled 12 students in the SAS program scholarship, and also the 7 students in the HEC need-based scholarship. You are always welcome to apply for those scholarships, because we are facilitating, our school is facilitating and promote the potential candidates and potential students, definitely, and we need to have those candidates, and also we are providing facilities, and also we also facilitate them with the scholarships if they are very potential for that course.
Thank you, Dr. Hamad. Okay, the question we usually face is that since it is the School of Dental Care Professionals, and usually people don't have that much awareness about, then what is the difference between the graduation in dental surgery, that is the dentistry, and the programs offered at School of Dental Care Professionals?
Yes, Madhya, thanks for asking this question. Actually, in the beginning, Dr. Madhya already explained it. We have a four-handed dentistry concept in this thing. And also, the BDS and the dental care professionals is like is an auxiliary sort of program. In the BDS program, we usually and purely deal with the dentistry. But in the DCPS program, we usually deal with the two concepts, with the dental hygienist and the dental technologist. And she has just already mentioned it, that we have the four-handed concept of dentistry. In the dental care profession, dental technology, and the dental hygienist, they make and they strengthen and strengthen the hands of the dental personnel, and they always they can always promote for the for the promotion in the future for their excellence in the dental hygienist and the dental technologists here in Pakistan as well and abroad as well.
Thank you so much. So my next question is from you, Ms. Madiha, that when you were discussing about the skills and what you guys prepare your students with, so how can you say that what kind of employment skills you guys prepare your students with? Means what kind of skills are taught in your program that the student can apply in their employment in future?
Yes. So the skills that you require, health promotion. If we talk about health promotion, there are numerous organizations that are working on health promotion. There are NGOs that are working on health promotion. WHO, World Health Organization, is working on health promotion. So it is not just about this course. You will be able to work on different platforms in various fields. You can promote health in marketing. You can promote health through NGOs. You can promote health through different working in different institutes. You can also go into academia, and you can pursue health research. There are numerous options for you once you are done with the course, because the skills that you are acquiring in the course, these skills are required further in master's program as well, in order to continue your studies and in order to practice in different institutes in different places. Like health educator, you can be a health educator in a school, you can be a health educator in a hospital, You can work at numerous places. It is not just that you can only be a hygienist and a technologist after completing this course. There are always broader options for you to expand your work field or to work in different fields with the same skill that you have acquired during your coursework.
Thank you, Ms. Satya. So if we talk about, as it is already, you can see it in the slides, that the research component is quite prominent in this slide. So how do you prepare your students for the research and research prospects, and what are the prospects of the research of your students or your graduates?
Yes, Nimrod. Basically, I must say that the research is the is basically is the is now is the era of the research now, because everything is going to be research, and everything is like the dental biomaterials and the dental technology is also related with the research as well. You can also relate them with the research, and also I always believe that the progress of you and also the institution also believe in the research. If you go for the research things, you will definitely find loads of ways around the world and also within the Pakistan as well, because there are loads of open forums where you can have where you can apply for and you can pursue for your PhDs, MPhil programs and MSc programs. And although we here at the Dao University of Health Sciences, we usually we are offering those research programs as well, and we are offering MPhil and masters and PhD programs as well, different programs. So yes, you are always welcome to relate those things with the research as well. So I must promote this thing. Yeah.
Thank you. Okay, talking about the academics. So can you briefly describe what kind of academic support you provide to the students?
Well, the university, as already been told, that university has a central library, a digital library. There are around 6,200 books in our central library. That student will have access and can get any of the knowledge and information regarding any subject. There are numerous books available on science, on chemistry, on physics, on biology, whatever subject they are going to read, on health promotion, even on health education, on these subjects, the subjects pertaining to this course, there are numerous books available. It is not just that you have to read your coursework. You will have enough information in the library, on in digital library. You will have access to many researches. Even if you want to learn about research, you will have access to many researches that are going throughout the world. The access is not available on every website, but in the university, when you'll be opening that in the university, you will have access to many of the researches that are not open easily. So you will have access to knowledge, and you can study there, you can sit there, you can spend a lot of time. There are no time limits in the library. You can sit and spend time, and you can study whatever you want.
I would like to add here, it's not just the library. See, the Dao University is now a smart university. You have everything on your mobile phone. So if you're within the campus or even outside the campus, if you're given an access to the internet, to the mobile phone, you have all the literature open access available in your mobile phone. So it's just that, as Ms. Madhya has just mentioned, if you're thirsty about the knowledge, you get it there. Yes.
Thank you so much. Okay, when we talk about, as you have mentioned, that the School of Dental Care Profession is established from 2007. So, what can you say about the graduates of your school and the alumni of your school, what they are doing right now, and what are the prospects that our graduates can expect in future?
Well, talking about our graduates are working in numerous fields. Most of the graduates are hired by Dao University of Health Sciences. As you can see, there is a growing demand of the profession, not only nationally, internationally as well. Now is the era of technology. So Most of our graduates are hired by Dao University, and few of them are working abroad. Some of them are working in Saudi Arabia, some of them are working in Canada. Actually, the license work, the license work is easy in countries abroad, and students get their immigration easily if they have these degrees, because these degrees are in high demand in countries abroad. So our students are working abroad, they are working in dental institutes here, they have their own laboratories, they have their own clinics with preventive dental services. They have, most of them are teaching, most of them are, and most of the teaching staff is involved in the research work. So our students have a good career prospect, and internationally they are progressing very well.
I would like to add a comment. Basically, here at the School of Dental Care Professionals, we are offering all these courses and all the things which under the umbrella of HEC, the Higher Education Commission, and all the things, all the credit hours is already being developed or according to the HEC criteria. So at the School of Dental Care Professionals, we offer these two unique programs. And if you realize the importance of these two unique programs, dental hygienists and the dental technologists, these two programs is directly and indirectly related to the community dentistry as well, and also then with the dental technology as well. Dental technology and the dental materials as well. You are always have the open window abroad and here in Pakistan as well for to have a community. You can go to the community health services, which you can pursue your career in the United States as well, and also with the other United organizations for the development of the community, for the development of the for the betterment of the community here in Pakistan as well. We have loads of community-based programs as well. And you will be like you are, as Madhya already described that you already have a very potential thing. So yes, you are welcome for those courses.
Okay, you use the word unique for these programs. So, if as a prospect, I would like to ask that how School of Dental Care Professionals is differentiated from other schools and how unique it is. What is the main difference? If you would, you can explain it in a one word or two. How can you differentiate your school from other schools who are offering these programs? What is the differentiation factor? If Ms. Saniha can add in that what is the differentiation factor of your program that has made it unique in terms of these products?
Well, as I have said earlier, we are the pioneers that are offering a 4-year DS program in these two main fields. That means that we are in this field since years. Since 2007, we are in the field and we are working. And the institute is offering these technologies. We have scholarship for students. We facilitate students in admissions in their fees. And the course is different from other universities because the 4-year BS program is, we have special faculty appointed for these students who already have studied this course, and then they have availed further degrees, their masters, and they are, most of them are enrolled in PhD programs, and they are teaching in these programs. In addition to that, this all is being supervised by senior dental professionals. That include PhD fellows, that include diplomats, that include our PhD holders, the main dental practitioners. It is being supervised by them. So actually, we have the entire structure here. We have the hierarchy here. We have professionals that are guiding us, there are PhD holders, they're guiding us in the field of research, they're guiding us in all the fields, and we are progressing through this.
If you will allow me, Nivra, to add with me this, I must say in the one word that Dao University, at the Dao University of Health Sciences, we are the first one to offer the dental hygienist and the dental technologist courses in Pakistan, overall in Pakistan, and as a BS program. So we are the pioneers for the thing. And now, definitely you can see there are loads of similar programs in other universities, especially in Lahore and in Peshawar, KPK. There are other universities they are offering it, but for the word of unique, as you asked, we are the pioneers.
So we can conclude that the opportunities the graduates of School of Dental Professionals are going to get is not comparable or is quite different from other institutes and other universities.
And in addition to this, the course is recognized by Higher Education Commission, and the degree from Dao University of Health Sciences is internationally recognized. So they do have good career prospects in Pakistan and out of Pakistan.
Okay. So if we talk about the when we discuss that we provide students with different skills and different we have different employment prospects of the future. Talking about your own institute, do you offer any kind of internship to the graduates of your institute?
Yes, we have an internship program. By the end of this course, when they complete all the coursework, we have a 1-year paid internship program, and a student has to complete it in order to have a clinical experience. Yes, we do have that. And in addition to this, students have options during the summer break. They can go for electives as well after necessary permissions.
I would like to add here, Nimra. See, we have, since this is the only BS program so far in Karachi, I believe, because two other universities are also offering. They've just started offering 4-year BS program. So they do not have, I don't think so they have any graduates as yet. One university is offering an associate program. So I think this is the only BS program that is in Karachi. So most of the diploma holders, they want to come and join this program and continue with their internships also. But as we mentioned, our first priority is to absorb our own students who've completed their graduation from the university. So since we have 3 dental campuses, 3 dental colleges under the umbrella of the University of Health Sciences, so our internees are deputed through these 3 dental setups, which are at different places in Karachi. One is at the Defense Campus or the Chinesa Campus, you may say. That is actually the hub of the 2 kind of global socioeconomic status. At one side there is a upper middle socioeconomic status, and the other side is a low socioeconomic status. So you get a good number of patients there. Then we have another campus, that is the main campus, which is the Tmc Campus, where the Dao Dental College is located. So our internees are there as an auxiliary to support the 400 dentistry there as well. And the third campus is our own, where we have the dental center, where we absorb our, it's again, we keep a merit of our students for the internship. So we keep the best students at our campus and we send. So this internship is actually mandatory for all the students, and they are rotated through these different dental colleges.
So we can say that the students are going to have a different kind of exposure, and the expertise and the experience that they are going to gain is going to be helpful for them in the future.
Exactly, and in both terms, like in the laboratory setup as well as in the clinical setup for the dental hygiene and the dental technology perspective.
Okay, if we talk about the other than the academics, if we talk about the other exposures that your students are getting when they are enrolled in your program. So how would you define these different exposures? Like what different skills you are teaching in your program other than the specific academic skills?
Well, we have co-curricular activities where students participate. There are our students are members to Dao Literary and Debate Society. They actively participate. They are encouraged to participate in these debates, and they are encouraged to participate in sports. They are encouraged to participate in any sort of competition. they're encouraged to do that, because it is not just that we have to build the academic skills, we have to build the teamwork skill as well. So in its entirety, a graduate should have everything, and not just academia. They should have skills of working in groups. They should have skills of working in team. They should develop this dynamic personality once they are done with the course. So they're able to absorb other personalities and they're able to work with other people. So that is why we are keeping this. Yes, this is important for them to participate in extracurricular and co-curricular activities other than academia. But that does not mean that they will get ample time for these extracurricular activities. There are the time is fixed by the Dao University. Dao University holds these competitions, and they take place at a time when the coursework is not there, or the students are on semester during the summer breaks.
I would like to add one thing. Beside of your courses and beside of your studies, extracurricular activities is also have a potential aspect and potential, you must say, the impact on your personal grooming and also your personal development. So we always welcome our students they should have to participate. They can participate in the different extracurricular activities. And also, as Madhya said, we have different societies. We have drama society. We have a different debate societies. We have different societies. You always welcome to participate in that one. But you need to focus on your studies, and after that you need to you can always welcome to participate.
Thank you, Dr. Hamad. As it is also mentioned in the slide that dental hygiene is related to the promotion of primary healthcare or oral healthcare and community health. So how can you say that your program is giving the exposure to the community? What kind of community exposure your students are getting?
Well, during our coursework, the community health visits are planned, and students are taking on these visits. In fact, in the final year, students do the entire work themselves. They organize a community visit, they conduct a community visit under the supervision of a senior or a senior dental practitioner. And they go for these community visits where they do all this. They do health promotion, they educate about health, oral health, and they are actively involved in this process. In fact, in third year of this course, the students come to us and they ask if they want to go for a community visit on themselves by doing all the work themselves. But in the final year, they do organize a community visit themselves. So it is more or less like a project. They do this under the supervision and in teamwork with other students, other surgery students.
So you are basically preparing your students for these community programs so that even after graduation, they can do these kind of promotions and do the visits in
Yes, actually the work they have to do is actually on clinical grounds, on the field they have to work. So they should know how to deliver knowledge as per the community, as per the knowledge of the community, and how do they have to tell them what is right for them, and how to keep their oral hygiene maintained. So they must have an exposure of the field in the community, and that of course is providing them.
So we can conclude that the School of Dental Care Professionals is basically training the students to provide the primary oral health care along with the oral rehabilitation through their different programs, that is dental hygiene and dental technology. If you have still any queries, you can put these questions in the comment box and we can answer these questions in the real time. Other than that, if you have any questions, you can email at info@duhs.edu.pk. And thank you so much. We had the panelists of School of Dental Care Professionals. Thank you so much for joining us and giving us the idea about what the program is currently offering. Now moving towards our next session, where we are going to welcome the panelist of Dao Institute of Radiology, we have our esteemed Program Director, Dr. Mukhtar Ahmed Ahmed. He is associated with the Dao University since 1996. He first joined this program, this technology in 2014 as a coordinator of associate degree, and later on in 2019, he joined this program as program director. Another panelist we have on board is Dr. Ume Ahmed. She's the consultant radiologist and assistant professor at Dao Institute of Radiology, as well as she's the program coordinator of BS Radiologic Technology program. So if you have any questions, you can still put these questions in the comment box. Over to you, Dr. Ahmed.
Assalamualaikum. Thank you, Nura. I'm Dr. Mohan. I welcome you all to Dao University of Health Sciences Virtual Open House. Good afternoon. I will introduce you to my institute. I'll introduce you my institute, that is Dao Institute of Radiology. It was built in 2008 under the umbrella of Dao University of Health Sciences. It was established to provide highest quality medical imaging, and it provides immense research opportunities, and it provides radiology education experiences of one of the experienced radiology faculty in Karachi. This is the faculty at Dao Institute of Radiology under the directorship of Professor Dr. Nasreen Naz, and we have a huge, highly educated and experienced faculty here. Now I will talk about my program, which is the PSRT, which is headed by the program director, Dr. Mukhtar Ahmed Ahmed. And under his supervision, there are two program coordinators, that is Dr. Qurratan Khabi and me, myself. And we have one academic coordinator, Mr. Mas Shamsi. We offer many postgraduate and undergraduate programs at Dao Institute of Radiology. Postgraduate programs include FCPS, MD program, diploma in medical radiodiagnosis, fellowship in vascular interventional radiology, fellowship in imaging, undergraduate program, that is our program, Bachelor's of Science in Radiologic Technology. We have also several diplomas and certificate courses, including diploma in MRI offered for 1 year, diploma in CT scan offered for 1 year, basic ultrasound certificate courses for 6 months, color Doppler ultrasound certificate courses for 3 months, diploma in echocardiography for 2 years, and diploma in vascular interventional radiology for 1 year. Now I'll give you an overview of my program, that is Bachelor's of Science in Radiologic Technology. It's a 4-year degree program approved by HSE, comprising of 8 semesters. Every semester has got around 5 to 6 courses. Total credit hours of our program is 132. Every year, 20 students are inducted. Facilities at DIR. DIR is located in state-of-the-art building, having well-equipped and furnished lecture halls, which are well air-conditioned, well lit. We provide Wi-Fi facility. We have a library facility, student common room, a lunch and play areas. Apart from these, students can avail the campus transport facility and the hostel facility also. What career pathways a BSRT graduate will end up? He or she will end up as a general radiographic technologist, as CT technologist, as MRI technologist, as a nuclear medicine technologist, or interventional radiology technologist, whatever his interest is. Regarding the admission criteria of BSRT, it's central one system that has that requires minimum marks of 60% aggregate in intermediate science, pre-medical, A-levels or equivalent examination. Candidate should have a SIMS domicile only. A-level applicant is required to produce IBCC equivalents for enrollment in the program. Important dates regarding our program. The form opening date is around start of December. Form submission deadline is around end of December. Per year, there are 2 semesters, that is spring semester and fall semester. The spring semester is from Jan-Feb till June. Vacations are offered in the month of July, and fall semester is from August till December. For any query, information regarding the program, please visit the official Dao website. Okay. Regarding the fee criteria, the admission fee is 180,000, including the tuition fee at the time of admission. Then the annual fee per year is 117,000. Enrollment fee is 2,000. Examination fee is 6,000, and transport fee is 15,000. Again, I will keep watching the official website for any change. Now I'm open to any question.
Thank you so much, Dr. Mayman. If you have any questions related to this program, you can drop your questions in the comment box below, and we will be taking your questions and answering this question by discussing with the expert panelist. Dr. Mayman, you discussed that you are providing the undergraduate studies. So, do you have any internship offered in your institute?
This is under observation.
Under process.
Yes, under process, under pipeline. We are thinking about it. The program is on the way. Soon you will.
So, but students do practice in other labs, or they can go for that?
Yes, we have a dedicated clinical practicum. Our students are coming to the campus for 6 days a week. Every day there is almost 3 hours dedicated teaching and 3 hours of clinical practicum. So their clinical practicum, they are hands-on from the first semester, from the very first semester. Throughout the 8 semesters, they are continuously getting the clinical teaching because our degree is technical based.
What can I add in this? But
Yes.
actually, we are not offering the internship program now at present, but it's in pipeline, and inshallah it will be available from next year. So, but we have asked many tertiary care hospitals, that's like Tmc, AKU, and we asked there to take our students, and they are doing their internship at present, and that because radiology is a so expanding field. So the facilities which are not available in the campus yet, that just inaugurated 1 month before, that's just like the gamma knife and robotic surgeries and the PET scan. So we have asked the JPMC director and JPMC radiology head. So our students are doing the internship there. That's a paid internship. So they are not only getting the benefits of internship, but they are equipped with the training with the advanced technologies which are there, which are not presently available in our university. And they are also rotating. We have asked AKU, Aga Khan University, few of the students have get internship there. So presently they are not. They are not getting any internship. That is not within the campus, but they are getting internship. So inshallah, that will be definitely will be from the next year. We will get internship in our institute.
So we can say that your program is, if it's not offering the internship in its institute, but it's facilitating
Yes,
the
yes.
students by collaborating
Yes.
with other institutes.
Yes, of course.
Okay, if we talk about the scope of this program, what you can say that what is the career scope of the graduates of the program?
So I can add this because this radiology is now a must part of every field of the medicine. And we have got so many new technologies that previously it was only X-ray technologies, but now there are so many fields like CT technologies, MRI technologies, as Dr. MNS told in the presentation. Now there are intervention radiology technologies, which is a very highly advanced imaging method. And most of the jobs, their seats are not available when a student applies in intervention radiology program. But we are offering here and training them to get a job in the intervention radiology program. So there's a big scope of radiology technologists, and everywhere is the demand. And adding to this, because from last 7-8 years, this is a 4-year program which is here. Previously, there was only a 1-year diploma program which was conducted by government of Sindh. And now every center, every new diagnostic center, every tertiary care hospital, private hospital, they are hiring the people which have got a 4-year degree, and they are not hiring a diploma holder degree candidate. So that's why they have got a very strong scope in this field to get jobs, to get international jobs. So this is a high time for them to come into this field.
So we can say that radiology, as it's the emerging field, and students, the graduates of your program have wider career prospects, and it keeps on changing and emerging. Okay, can you please, Dr. Veman, can you please walk us through the courses you are offering throughout your program?
Yes. We are offering basic courses in first 4 semesters, and then advanced courses in the last 4 semesters, including like in semester 1, they are offered English, anatomy, physics, physiology, mathematics, computers, and basic knowledge of radiographic positioning, which is the core, which is the. Then in second semester, this further advances radiographic positioning. Again, we have physics, we have pharmacology, and we have English. Then in semester 3, there are basic courses of Pakistan studies, Islamic studies, and sociology. Then there is a basic course of CT. Then in semester 4, we have pathology and a basic course of MR. Then from semester 5, advanced courses, including echocardiography, cross-sectional imaging, ultrasound, and then we have advanced CT, then we have advanced MRI, and in semester 8, we offer vascular interventional radiology. And I would like to add here that, as you all are aware, now it's the era of research. So we also provide them basic knowledge of research till advanced. They are also supposed to write a thesis, which comprises of our last 3 semesters, 6, 7, and 8. And we train them in PACS and biostatistics. This is how our course.
So we can say that initially in first 2 years, basically students are trained in their core courses and general education, and then moving towards from 3rd year or 4th year, they are going towards specialized courses.
Specialized, so that is our field. That is the radiology technology.
Our prospect students are concerned about the test criteria, that on what basis they are going to be judged and they are going to be evaluated to get the admission in your program. So can you please brief us about what exactly is the test pattern and what is the criteria of admission?
The test is central. One test for all the BS programs, like they have to prepare according to their level, that is pre-medical basic subjects, and they have to emphasize on English and mathematics also. And the admission criteria is comprises of SSC marks, HSC marks, the aptitude test, and the.
Okay, when we talk about in terms of academics, after graduation from your field, what can you say that your graduate has a future prospect in terms of academics, how they can proceed in academics? Is there any master program?
Yes. In academics, we are not offering master's program yet, but it is in pipeline. The university is planning, and we have some discussion with the academic committees. And they are definitely thinking like that we will brought this program into a college of radiography. That will be the one of the kind in this university. And then college can provide the master's program, PhD programs. So they will take a couple of years and we'll offer them a master's program. But presently, our BS program is recognized by HEC, and it is internationally recognized program. So few of our students have also applied at the UK and Canada in a master's program, and they have got admission there in the master's program according related to our BS program. So this degrees which we are offering is definitely competing them for a master's program. And you should be glad that two of our students have got Rhodes Scholarship for a master's program in UK, and one has applied for a Oxford University Scholarship. So this is a program which is definitely promoting the candidate for their future plans. And when we definitely start a master's program, this will be ideal program for the candidate.
So we can say that the students can apply internationally for the
Yes,
further
of course.
studies, as Dr. Mukhtar has already mentioned that two students have already been selected for the scholarships abroad. So if you can say that in academics your students are doing well, but other than academics, what kind of different skills you are preparing your students with? What kind of soft skills your students have, and what they are learning being part of your program of your institute?
They are encouraged to participate in the sports week. It is celebrated by the university in the month of February, and also there are interdepartmental sports activities. Also, they are encouraged to participate in the Eid al-Adha conference. They also participate in art competition. They also participate in debate competitions, and this is how they are
So adding to Dr. Memon, as I am the Secretary General of Radiology Society of Pakistan also. So I'm also involving them in the academia through the forum of the Radiological Society of Pakistan. And we yearly celebrate a World Radiography Day, in which that's a full day program of the radiographic technologists. And Dao has got a strong participation in that by presenting their papers, research articles, as Dr. Memon has already told. We give them a research project. So that research project they produce during the seminars. So that's a good extracurricular activity, and they will be sometimes selected in national conferences. And even in future, we are planning to send these articles of the candidates to the international radiology programs. So they couldn't be promoted like that. And one extra thing, that there is only one journal of radiology. That's of Pakistan. That's the Pakistan Journal of Radiology. In that, I am also the chief editor of that. So we have got a page of the technologist section, and in that, these researchers, they can put their technology and add into the research to these journals. There are so many activities going on for the promotion other than the general education. They can be advanced through these forums.
We can say that the exposure your students are going to get is from your expertise and from the experience of the faculty and of all the opportunities the students are going to get it incomparable when they are going to join this program. Other than that, if I talk about the facilities available for your students, so how can you elaborate it? That what are the facilities other than the academic facilities?
I have mentioned about the academic facilities, and then we have the clinical practicum facility. That is very important. That is extremely important for the radiologic technology student. That we have so many X-ray machines. We have a fluoroscopy unit. We have almost 8 CT scans working at our different satellite centers and the main campus. And we have MRI machines. We have almost 4 satellite centers where our facilities are available, and our students rotate on all the facility according to their timetable, and they are divided in small groups, so that they can learn how to manage in groups at their respective station, and this is how they are.
If we talk about the scholarships, do your program offer any scholarships to your students and the students who cannot afford the fees or who are needy and need a financial assistance in that? So how would you say that what kind of scholarship and or any kind of fee waivers you provide to your students?
Yes, Nima, we have got scholarships for these students, and we are offering HEC-based scholarship that's offered by university, and then there's the SAS program, which is offering so many scholarships for our students. Then there are some other scholarships like Scotland scholarship and Fulbright student scholarships. So there are so many scholarships, and you will be surprised when you see the statistics of the student, that how many are getting the scholarships, so almost 60% of our students are studying on a scholarship. So that's a big number of getting the scholarships, particularly in this PhD program. And but only one thing is that clear the scholarship criteria, that this is not offered in the first year of the program. So the first year admission fee and the tuition fee is to be borne by the candidate, but rest 3 years the tuition fee is mostly from the scholarships. So this is the scholarship policy.
So, do the students have to maintain a certain CGPA or certain?
Yes, of course, that's the requirement of this financial aid, their financial background first, then the CGPA that should be on higher level. So this is just like a merit-like scholarships. We're not offering to anyone who's applying.
So we have two kinds of scholarship that are merit-based as well as need-based students scholarship. Okay, if we talk about the alumni of your program, the graduates of Dao Institute of Radiology, how would you say that where they are placed currently and what they are doing with their life right now?
I would like to mention that our first batch of BSRP graduated in the year 2019 with almost 14 candidates. Then in 2020, there were 15 candidates, and recently almost 35 candidates have graduated. So a total of 64 candidates have already graduated from our program. Many of them are have been hired by our own institute, and they are also working in other institutes like Karachi. Some of them has run.
So I can add in this also that this radiology program is just not a 4-year BS program, but there are so many branches to cope with the field. That is one thing. Every department now needs a managerial-like post in the radiology. And these managerial posts, the first requirement that the candidate have done some bachelor program or a radiography program. And Dow University is also offering some MBA or BBA-like program. And then generally in market, there are programs which are Sunday program like BBA program. So a student can add with them the BSc program, additionally BBA program or health management program. Then they are offered so many good positions in a radiology departments on a managerial post. And again, the vendor companies, they require definitely qualified radiographer to be cooked with the machines for the installment of machines with the engineers. So vendor companies, they are hiring people having the bachelor's program degree. So there are so many scopes in this field, and people are applying there. And maybe in, our one student have got a manager post in a newly developed branch in the Karachi of a diagnostic center. So there is a good future for them if they go, and I think this is a best field for them.
So we can say that the prospects are just not limited to the technical field. They can go for the managerial positions or administrative positions in future as well. Okay, Dr. Mehmet, can you please let me know that if the students enrolled in your program, what kind of assessment methodology you use to promote students to other areas, to different semesters?
Our assessment policy comprises of formative assessment and summative assessment. Formative is the ongoing assessment throughout the semester. Yes, 16 to 18 weeks. And in formative assessment, they have to clear midterm. They have to give the class presentation, and there are class assessments. And in summative assessment at the term, they have to have a theory exam, and then they have a bio exam, and then they have a clinical practical exam. We assess them clinically. And if they clear it, then they go to the next semester, and there are year-changing semesters. That is semester 2, semester 4, and semester 6 are year-changing. Even semesters are year-changing semester. So if they don't clear till then, like if they don't clear semester 1 and semester 2, they cannot go to semester 3.
Okay, if we talk about the opportunities your institute provides to students, specifically if we talk about the volunteering services or any opportunity, is there any opportunity for your students in your institute that you provide your students?
Yes, for voluntary purposes, we are involving our students. Recently, there was a program, and every year that's, as you know, the October is the month of the breast cancer awareness. So our students are on the front foot for organization in these programs, and we have in this year, last October, a good program of breast screening program. So our students are involved in the screening programs, and we are planning them to go outside the campus for and help out in these screening programs from other authorities to help them. I mean, they love that to do these voluntary work for these programs.
Okay, if we talk about the career guidance to your students when you're graduating here at your institute, what kind of career guidance you provide your students throughout the academic sessions?
We have highly qualified technologists available. We have highly qualified faculty available. They are there to provide them career guidance, and that's why I ask.
And also adding this that as Dr. Ahmed said, we have got a huge number of machines by department. So state-of-the-art technologies there, starting from general radiography to fluoroscopy to ultrasound, mammography, CT, MRI, then DEXA machine, then intervention suits. So they have got we see the candidates in which field is particularly got a interest. He or she has got what interest. Then we promote them, have sittings with them, that your future is that you should plan for a CT technologist. So that's why they think about that. They search websites to see what advanced courses are in that field. So there is a method that these students always come to us and our faculty that what will be my guideline, what will be the future of them. So we definitely are advising them, guiding them to go in this particular field. This is the future, this is the future. And they are very happy with that there are so many branches and options to go in a particular field and just doing this one thing.
If we talk about the lectures or the teaching methods, you guys actually your institute explore. What is the teaching method and what are the methodologies used by the teachers, by the faculty of your program to basically train students for the future?
As you're aware, face-to-face teaching was always there, but during the pandemic, we have complete, like all the universities, we have also shifted to the online teaching. Students were enrolled on Dao online education system, and there were virtual classes. Apart from that, there is online books available, student aid materials available, class presentation were there, additional videos were there, online tutorials and videos were uploaded, and this is how.
So they are just not going to be taught in the traditional manner, but since the technology is there.
Actually, our field is other than the theoretical, this is a practical field. So how much the student work on the machine, that's his ability to go up with that. So that's why that was a problem during online sessions, that we are only teaching them a theoretical background, but we have put so many tutorials and videos from the various forums, and then they were seeing there. But in that pandemic positions also, we just taken some opportunity that few of the students come on alternate days to be with the SOPs. They will be involved in the department to at least give some part in the practical works also. So that's why most of our studies, apart from the subjects which are not a part of the radiology, just like basic courses, but radiography training is actually a practical training. So that during practical training, the most of our senior technologists are there, and they are teaching them very nicely. We actually go to the machines and ask them what are the difficulties. Faculty is doing so much to practically give them a knowledge to compete in the world in any part of the world.
We can say that since it's the technical field, the students are basically getting the first-hand experience by involving themselves in these laboratories and getting the exposure of how they are going to work in the future with these kind of fields.
To actually learn and practice on the machines.
So you are training your students on different machines as well.
Yes.
So thank you so much. Thank you so much. The Institute of Radiology was here with us. And if you have still have any questions related to this program, you can still put your questions in the comment box, and the team is here to answer your queries. And even if you have missed the today's session, you can whenever you want, you can go to the Dao's Facebook page and official page, and you can go through these recordings of these sessions. And even about the previous day sessions, you can go through the recordings of these as well. And if there are any queries left in this whole session, you can still email your questions to info@duhs.edu.pk. Thank you so much, Dr. Mukhtar and Dr. Ume Ayman, for joining us here. I hope that all the queries related to these programs have been answered. And if there are any queries left, you can put your questions in the comment box, or you can even email at info@duhs.edu.pk. Tomorrow we have another session that is the last session of Dao University of Health Sciences virtual open house, and we will have 3 programs joining us, that is Dao College of Biotechnology, School of Postgraduate Studies, and Institute of Business Health Management, and they are going to walk you through the different programs offered in their institutes, that is BS Biotechnology, the master's program in different biomedical sciences, and the BBA and MBA program in healthcare management. So please join us tomorrow as well for the information related to these sessions. And the session would be scheduled from 11 to 1. And I hope that the queries you guys have been curious about have been answered. Thank you so much for joining us. Allah Hafiz.